Hello, my name is Vivian Para. I'm going to be discussing the description of the family dynamic. First, we have the great grandma, which is Jessica, a 79-year-old widow. She's lonely and recently diagnosed with Alzheimer's. She's unable to drive and can't always make her doctor's appointments. Then we have the grandma, which is Rebecca. She's a 60-year-old daughter of Jessica. She works full-time and wants to provide for her mother, and she seeks Janice, her daughter, help to care for Jessica. Then we're off to the parents. The parents is Janice, a 39-year-old female. She's a part-time cashier. She struggles to make ends meet, and she agrees to move in with Jessica to help watch over her. But later, she starts stealing money from her grandma. Then we have Mark, which is a 40-year-old partner of Janice. Recently lost his job, and he struggles to make ends meet as well, and he's physically abusive to Janice. Then we have their son, which is a 20-year-old son to Janice and Mark. He's looking to attend colleges, but he's unsure of his future, and he plans to get a job, part-time cashiering.
I'm Kaylin, and I'll be talking about the multi-generational differences between the four generations that we talked about in our scenario. So Jessica, who's the grandparent, she's considered a traditionalist. This is the oldest generation. They're technologically challenged, but they're very loyal and supportive of their family. And despite what's happening to her currently, and despite loss of her financial freedom, she is very still supportive and loves her family, and is obviously very thankful that they are helping her through this difficult time being diagnosed with Alzheimer's. Rebecca, who's her child, would be considered a baby boomer. This generation is very hardworking, very productive. Rebecca, in this case, shows her independence by leaving a bad environment that she experienced with a past relationship. And she also was very resourceful. She was able to figure out a way that she could help her mother without moving her to a home, and just made her adjustment to this new diagnosis a lot easier for her. Janice and Mark, which are Rebecca's children, who also move in with them to this new environment. And she is the one exploiting her grandmother's finances. She is having a hard time trying to find independence by using money as that key. Because if she's in school, she doesn't have an income, but she's taking advantage of the older generation. She's very technologically adept. This whole generation is. They grew up with it. And she also needs to work on balancing everything. But the problem is she's been exposed to intimate partner violence with her own partner. So we need to make sure she also doesn't project this into her new environment, to her mother or her children. Nathan is considered a millennial. He's the grandchild of, in our scenario, and he lives with Janice and Mark prior to this, obviously, and he's seen them argue and fight. So we can assume that he might have a harder time later adjusting with his relationships. This generation also really is in need for instant gratification and recognition of accomplishments. And because Janice is working so much and she might not be paying a lot of attention to Nathan, he might feel neglected as well. But this generation has also been known to be very adaptable to change, so he might be okay and not be affected by watching this violence with his parents. But he'll also be very adaptable to this new change in the living environment.
Hello, I'm going to be talking about misunderstandings between different generations. So first we're going to start with the grandparents. They don't understand technology, and communication style is something that they like to do in person. They also believe in a traditional family where the wife and husband work through their problems. And they also have lived a full life and are wise. So that may bring some misunderstandings between the family members. Then we have the parents, and they are considered the sandwich generation. So they were both parents and children. And their communication style is a mix of face-to-face or the use of technology. Then the children, They understand technology and use technology for communication, and they also believe in independence, and sometimes they're unwilling to take advice. So you can see how the children and maybe the grandparents would have some misunderstandings because the grandparents are wise and they want to tell the children how to act or give them advice, and children don't want to take the advice because they believe in their independence.
Thanks, Vivian. Again, my name is Nataporn, and I will be speaking to you today about 3 developmental theories: Bowen's family systems theory, Erikson's psychosocial developmental stages, and Rowan Kahn's successful aging model. First, we'll begin with Bowen's family systems theory. Bowen's theory believes differentiation of self, or DOS, is critical to individual and relational maturity. According to Bowen, levels of differentiation are related to stress levels, personal reactions to stressors, and the degree of contact with extended family. The family as a unit has a global level of differentiation. These varying levels among family members can help encourage the development of an individual, making DOS both an intrapersonal and interpersonal process, in which one can maintain a sense of individuality while simultaneously sustaining healthy connections with others. Next, we have Erikson's psychosocial developmental stages. These stages relate to the process of one's development through life, identity formation, and the establishment of a coherent sense of self. These stages are often marked by a turning point in the life cycle in which a new perspective in looking at the world develops and helps form the belief systems in which we engage with ourselves, the world, and others. It is important to note that each stage of growth occurs simultaneously within a social setting and intergenerational setting. Lastly, we'll look at Rowe and Kahn's successful aging model. It is one of the most influential in their field of study and is based on 3 components: low probability of disease and related disability, high cognitive and physical functioning, and active engagement in life. Their theory focuses on identifying protective factors and the development of effective interventions to promote the highest possible quality of life in old age. An expanded idea of successful aging has been posited to include desirable living situations for those who grow old in good health and who grow old with care needs. The last statement implies the importance of the relationship between the care recipient and care provider. Their joint endeavor to maintain quality of life for the older person can influence successful aging for everyone. Now, we'll have Alexis presenting developmental tasks.
Thanks. Next, we'll talk about developmental tasks, and specifically, which family members' developmental tasks are being hindered or facilitated by the abusive family relationship. We'll start with 79-year-old great-grandma Jessica. Her developmental task of life satisfaction is being hindered. She's recently widowed, and she has a new diagnosis of a deteriorating health condition. She is unsure how Alzheimer's will affect her life. She's also suffering from financial abuse, and she suspects that money is missing, but her claims are often invalidated, and they're blamed on her Alzheimer's. This is causing her more confusion. Nathan, the 20-year-old great-grandson, his developmental task of role development is being facilitated by the relationship. He's able to care for his great-grandma, and he's able to see his goal of pursuing nursing. He is able to mature, choosing responsibility in various situations, and he's able to develop his identity. He sees how he wants to behave and how he wants to treat women. He has familial support and is able to bond and nurture his relationships. Next, we'll talk about recommendations for the family.
Hi, my name is Lisandra Rubalcava, and I'm here to talk about the recommendations that we made for our family. For Jessica, who is newly diagnosed with Alzheimer's, we recommend that her and her family contact her local Alzheimer's association. There she can get assistance with resources to determine if her memory impairment is progressing, She can get tips on how to cope with the changes and also tips on how to maintain a healthy lifestyle. We're also referring the family to social services, especially because Janice and her immediate family is having financial issues. Social services might be able to help her get benefits such as SNAP or CalFresh, and also maybe get general relief. For Jessica, she can actually most likely qualify for in-home supportive services where she can get a caregiver that can help her when her family is away. This caregiver can help her with cooking, cleaning, medications. That way it's not a big burden for her family. And also for Mark and Janice, we're recommending counseling, couples counseling, because they've been having a lot of relationship issues where Mark has gotten violent, and Janice grew up in a family where there was domestic violence. So now she's receiving intimate partner violence, and couples counseling can help them realize their situational stressors and give them coping strategies that can help Mark stop using violence as a problem-solving technique. And now for both Mark and Nathan, especially for Mark because he's a 40-year-old male who has been having a hard time keeping a job, we're referring him to career counseling. There he can possibly work with a career counselor where he can set goals for himself, prepare better for job interviews, and hopefully get a job where he can be happy and keep for long term. Nathan is currently 20 years old. He's the youngest of the family. He's not really sure where he wants to go in life, so a career counselor can point him in the right direction. And finally, our last recommendation is for Jessica. She's been suspicious that Janice is possibly taking her money, and Janice tells her that she's being forgetful. So we're recommending that she set up a durable power of attorney. She's thinking she might like her daughter Rebecca to oversee her finances as long as she can still continue to monitor them. So we're recommending she does that so that she doesn't become a victim of financial exploitation. Thank you very much.